On behalf of AMA Private Practice Simple Solutions, welcome to Marketing Primer 1. What makes your practice unique is your marketing advantage. I'm Rob Rosenberg, President of Springboard Brand and Creative Strategy, who, along with my colleague, Donna Arbogast, will be developing and presenting the content in this marketing series. This primer will explore and discuss how private physician practices can differentiate themselves in their respective marketplaces and be uniquely positioned with a competitive advantage to meet patient and community needs. Please note that an accompanying learning guide for this primer is available online with exercises to help you and your office staff determine your marketing advantage. As specialists in healthcare marketing, we believe that most brands have an inherent difference and distinct advantage. You just have to look for it. In the case of private practice physicians, this advantage often lies in the interests, personality, and style of its practitioners and its office operations. Additionally, the advantage may be in the way the practice positions itself to attract new emerging markets or growing patient populations. This primer will explore these and other approaches that practices can pursue to create a marketing opportunity. Specifically, the agenda for today's primer includes the following. First, understanding your ecosystem, taking a close look at your practice structure and operations, as well as the overall marketplace to help identify unique advantages and opportunities. Often, your marketing advantage is closer than you think. In addition, understanding your existing patient and case mix will provide you with insights you can leverage to attract more like opportunities or to pivot and attract new patient populations based on community needs. Your operations and business practices are also important categories to evaluate as you align with the growing needs of your patients for access, convenience, and expertise. Of course, your marketing advantage should be your own. Therefore, exploring and discussing competition in the market is equally important to identify gaps in the market or marketing platforms that other practices have already claimed. Finally, we will help you bring together all aspects of your practice so you can develop a relevant brand story to share with your staff, patients, and the marketplace to give you a marketing blueprint for growth and sustainability. Well, let's get into it. Here's Donna Arbogast to talk about your practice differentiators and how to begin to identify your strengths and unique attributes.
Thank you, Rob. As you described, the process of identifying the advantage that any organization or physician practice has in the market is actually quite logical. To begin, we want to help you define your ecosystem. So as Rob mentioned, basically we want to define all of the interconnected elements that make up or have an effect on your practice. The interests and areas of expertise of you and your team, your patients and their needs, the community in which you work, your employees, your vision and mission and your values, your operations, where you're located, your hours, your accessibility. All of these elements can be considered part of the ecosystem that we want to help you fully understand so that you can make marketing decisions based on a solid foundation of information. Let's start with your strengths and your practice's unique attributes. In the learning guide that accompanies this primer, we recommend that you and each member of your team take a moment to do a personal assessment of interests, motivations, and goals. That will help pave the way for thinking about the practice overall. After the personal assessment, we suggest that you review together as a team some key questions that will uncover what sets your practice apart from others. Some of the key questions to consider with your team include: what special areas of interest or expertise do you and members of your team offer to patients? Knowing what you offer, what do you do best? Do you offer any special or unique services, things like prevention and wellness visits or education, routine physicals or sports-related care, mental health, geriatric care, or pediatrics or family medicine? advanced testing or diagnostic capability, or office-based procedures. Is there a service or specialization that you would like to offer in the future, something that might fill a gap in care in your area or practice? Now consider what distinguishes you from other providers in the area. Depending on your practice's specialty, you might consider some of the services you identified in question 3, or such things as unique levels of expertise and training of the team, outcomes or quality achievements, virtual appointments or easier access, online scheduling, same-day appointments, short wait times, or your customer service. Maybe your patient satisfaction levels set you apart, access to clinical trials or other advanced learnings. As you review the team's answers to these questions, begin to focus on what makes you a better choice for care than your competitors. And we'll talk about competition a little later in this session.
Thank you, Donna. The ecosystem definitely starts on the inside and provides an excellent foundation to develop marketing advantages of your practice. Another part of the ecosystem that can help differentiate private practices in the market is an assessment of patient and community needs and how your practice meets these needs through its operations. First, let's take a look at your patients and the community at large. By doing so, you'll be able to assess the profile of your current, quote, customer base and identify other opportunities similar to them. Demographics of your current patients include their age, gender, ethnicity, and, as best you can, socioeconomic factors such as employment and income. This information will help you identify who it is in general your practice attracts. Of course, your case mix will help you identify the services you provide and perhaps shed insights on a unique niche that your practice provides. Additionally, you'll want to know if there are any community health needs that your practice can meet based on the internal assessment discussed earlier. For example, is there industry in your area that causes certain health risks or conditions that your practice has special expertise or interests? This can be an effective marketing opportunity for you. Does the population of your community require any special services or considerations by your practice? These might include weekend or extended hours, telehealth, or other operational programs you can implement to meet these needs. In addition, are there special interests or hobbies that are popular in your community that present health implications and align with your practice's expertise? Lastly, based on the assessment of your team, are there specific patient populations your practice would like to reach and attract? For example, these can include demographics such as older women or younger men, or special interest groups such as weekend warriors who need prevention and treatment for sports injuries. Based on your assessment of practice strengths and patient information, you can take a look at your business operations to make sure they match up. Using a customer lens of patients you currently reach and those you would like to attract, evaluate the components of your practice, such as its hours and capacity, accessibility in terms of location, parking, and ease of access. How responsive are you or can you be to the needs of your patients? Does your office environment and ambiance reflect the profile of your patients and their interests? What is your online presence in terms of web, social media, and so forth, and does this align with those you serve and are trying to attract? The Advanced Marketing Primer Series will probe deeper into the development and use of effective online strategies and resources for your practice to utilize. Stay tuned for additional information on these topics. Creating a marketing advantage not only takes into account the strengths and services of your practice, but must reflect that of your competition as well. While you most likely have positive relations and referrals with other private practices, you'll want to make sure that your marketing advantage is not equally comparable or already being used in your community. Donna will take you more through this topic.
Now that you've given considerable thought to your own practice and the needs of your patients and community, let's turn our attention to your competitors. We talked a bit about this in step 1 when we asked you to consider what sets you apart, but let's dissect the competition in a little more detail. As Rob discussed, competition in your community will vary by specialty, affiliation, location, and other determinants. To start, take a moment to list your competitors by name, location, and affiliation. For example, consider how many locations they have and the regions they cover. Consider whether they are aligned with a hospital or health system, and if so, do they leverage that connection in any way? Based on your own experience and what you hear from patients or what you read on their website, do you know whether your competitors offer any services or specializations that distinguish them from your practice? What is their presence in the community? Do they advertise, and if so, where? What message or messages do they focus on in their advertising? Do they sponsor and/or are they visible at local events? What do they claim in all of these communications as their market advantage? And finally, where are you vulnerable, particularly as you consider what you offer to your patients and the community and what your competitors offer? This information will be very important as you finalize your own brand story. One other step before we describe how to bring all of this together, your practice, differentiators, the overview of your community and patients, and your competitors, is to review your vision, mission, and values statement. As we've said, all brands begin from within, and one foundational element of any successful organization is its vision, mission, and values statement. If you already have such a statement, we recommend reviewing it now with an eye to the information you've uncovered during this exercise. Are your vision, mission, and values aligned with some of the key points you've discussed? If they are, great. If not, or if you don't have such a statement, we encourage you to create one, and we promise it's not that daunting. In the learning guide and on this slide, we provide a simple framework. So your vision involves seeing the possibilities. It's a broad statement. What would you like to see for all the patients you serve within the context of the service you provide? Your mission then is more focused, and it describes how you carry out your work, how you help bring your vision to life. Finally, your values offer the context for your work and how you make decisions about your strategic direction, how you provide care, how you recruit and retain employees. You might say, to accomplish our vision and mission, we will base our decisions and actions on the following core values and beliefs. Once you have confirmed, revised, or created your vision, mission, and values, we recommend keeping it front and center with your team members or even posting it on your website. It will help to build and sustain internal engagement and will enhance the chances for success when you market externally. And finally, Rob will now describe how you can use all of the insights from this exercise to create your unique brand story.
Identifying your best marketing advantage can take the form of a unique and relevant story to the marketplace. Unique in that it reflects the skills, interests, and personality of your practice. Relevant in that it mirrors the community and those segments within it that you currently attract or would like to impact further. As said, these elements include your office operations, accessibility, and overall persona. With your team's input, begin to write your story and identify what sets your practice apart. For example, a story for a private practice primary care provider in Columbus, Ohio might look like this. Now, this is, of course, a fictional case study to demonstrate the process that we've talked about so far during this primer. This is a practice for Diane Smith and Associates. The practice itself has 8 practitioners, including 3 female physicians, 3 male physicians, and 2 female NPs. 2 physicians are certified by the American Board of Lifestyle Medicine with a particular focus on preventing, treating, and reversing chronic disease. Another is a North American Menopause Society certified menopause practitioner. All practice members are particularly interested in providing preventive care and early screening guidance in areas such as cardiovascular disease, diabetes, breast cancer, and colorectal cancer. Donna will walk you through the rest of the case study.
Looking at our patients and community, we serve 8 zip codes in the Columbus, Ohio market. Our current patient base includes both men and women, with a skew toward women over childbearing age and men age 50 plus. However, Columbus is Ohio's fastest growing city, with an influx of younger men and women attracted by jobs in industries such as education, healthcare, real estate, professional services, and fashion. We have an opportunity to strengthen our reputation with and expand our reach among postmenopausal women, while also building our reputation and patient base among younger patients, particularly women new to the market, leveraging our interest in lifestyle medicine. When we looked at competition, we determined we are the only providers in our close-in zip code areas with certifications in both lifestyle medicine and menopause. And our major competitor, a practice of 10 primary care physicians a few blocks away, focuses heavily on family practice and sports medicine. This practice sponsors one local marathon and a community sports league. This all leads to our story. We are a primary care practice, well-positioned to appeal to women of all ages, those committed to a healthy lifestyle at an early age, and those learning to manage changing health needs as they move through and past menopause. Operationally, to meet our patients' needs, we are going to extend our office hours an additional 1 day per week and more heavily promote our weekend hours and telehealth accessibility.
Again, this is just an example of a brand story that summarizes the steps we've outlined today. We encourage you to download the learning guide, schedule a meeting with your team to discuss it. What ideas rise to the top? Are there common themes? What sets you apart from competitors? Which of your practice attributes most closely align with your patients' needs and those in the community? These are all excellent discussion points, and by answering, you'll begin to solve the question of how your practice can identify its unique marketing advantage and develop a brand that appeals to those who identify with it. Thank you for joining us today. This is Primer 1 in the marketing series, which will continue to help you identify unique advantages in your practice that will improve your awareness and visibility in the market. Our next primer will discuss research opportunities to learn firsthand what your patients know about your practice, as well as existing studies that inform you of community health needs. Advanced programs are on the horizon too, and will focus on your use of digital marketing, social media, website, and other digital tactics to retain and attract new patients. A reminder too that an accompanying learning guide is available for this and all other primers, and it will provide your team with exercises they can perform to better understand your marketing advantages. Thank you. For additional contact information, please see the following.